Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about Modifier 57. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really like sharing the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, hit the like button, and at the end of this video helps you, I hope you'll share it. Okay, so let's get started. All right, Modifier 57. What is Modifier 57? Now, I used the CPT Professional Edition from the AMA for my reference today, and I used the Appendix A because that is where all the modifiers are housed, and it will give you a brief description of all of them. So, Modifier 57, which is decision for surgery, is, according to the book, an evaluation and management service that resulted in the initial decision to perform the surgery may be identified by adding Modifier 57 to the appropriate level of evaluation and management service. Now, why are adding these modifiers so important? It is important to add modifiers because these modifiers are telling more of the story. Whenever somebody sees a 57 attached to this evaluation and management, it is saying, and according to the Novitas website, the appropriate use is append only to the evaluation and management procedure code, where the decision to perform surgery is made the day of or the day before a major surgery during an evaluation and management service. Now, what is a major surgery? A major surgery is any surgery or procedure that has a 90-day global period on it. Okay, so whenever you are looking at whatever they decided to do, and if that particular procedure has a 90-day global period on it, and you can find this out by looking in the CPT Expert Edition. You can also find it out by using an encoder, okay? That is how it'll tell you how many global days are on it, okay? And when you find that out, and of course, looking at their documentation, whatever evaluation and management level that they come out to, you can add that Modifier 57 if they are going to be performing the surgery the day of or the day before, okay? You can add it to that evaluation and management then. A good example, and I'm going to give you guys a good example because I do work orthopedics. So I'm going to give you guys a good example. Now, you're thinking, okay, a major surgery. So this must mean that they have to go to the OR, that they're going to be hooked up to anesthesia, that it's going to be this big production. I work in the orthopedic clinic, okay? I work in orthopedics and podiatry. And a fracture procedure, whether it is a with manipulation, fracture treatment with manipulation, with no manipulation, these have a 90-day global period on them. So it doesn't necessarily mean that the provider has to go to the OR in order to get this Modifier 57. If the procedure has a 90-day global period on it, you can get that 57 modifier attached to the evaluation and management service. This throws some people. I've had this argument before many times, sometimes with my providers, because they go, well, why do we need to add that? We're not going to the OR. I'm just putting them in a cast. Yes, but you putting them in this cast is treating, you're making the initial decision to do this. You're putting them in a cast this day. You're treating this fracture. And this fracture has a 90-day global period on it. So that is why you would get that Modifier 57. Well, Blue, that doesn't make any sense. And I'm like, I know, but according to the rules and the way that they do things, okay, people who are way above me make these decisions. So, I mean, that's all we can do, right? We just follow the rules. But yes, it is going to depend on the procedure itself. So, you're only going to report this the one time, okay? And again, when you understand and really know and you dive in to these modifiers, it's really going to help you tell more of the story, okay? And these are just, 2 digits, and they will tell you, like in that instance of 57, that it is for the decision for surgery. It'll tell you if, like, on certain procedures, the laterality of of the procedure? Was it done bilaterally? Was it done, that would be a 50 modifier. Was it done on the right? RT. Was it done on the left? LT. Was it done on whatever finger or whatever toe? You know, they have individual modifiers for each fingers and toes. So there's a lot to be said and a lot to learn from, you know, different modifiers. But knowing which to appropriately put it on, like 57 only goes on evaluation and management codes. That's very important. But reading in Appendix A under all of the descriptions of the procedures or the descriptions of the modifiers, it will tell you where it is appropriate to apply that. And if you need to get clarification, I strongly recommend that you go to CMS.gov, okay? There's so much to learn from that website. I also recommend that you really dig deep in that book. And if you can't find it in there, then you can Google, okay? And sometimes it'll pull up a reference. Sometimes it will pull up a discussion thread, okay? And if you are looking at somebody's discussion thread, okay, sometimes they'll pull up a discussion thread about a modifier or whatever question you're putting in about medical coding. And you need to make sure that you carefully consider the information that is being given to you, okay? Always, 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 I cannot stress this enough. Use reputable resources, okay? Going to a discussion thread can lead you down the rabbit hole, okay? One of two ways. Really good, because it'll make you think, or really bad, because the information, there's no way to verify if that information is really accurate, okay? Because sometimes when people are interpreting things, they can sort of take what they've learned. Sometimes if they are just going along to get along and they're not exactly doing their research, and they say, well, we do it this way at our facility and no one's ever questioned it and it always goes through. But then when you start to look and investigate, you find out that maybe it isn't right. You know, maybe their practices weren't accurate, okay? And it does happen. So always make sure that you're very careful. You can look, you can take advice, but I always recommend to you guys, make sure, double check. I mean, you can double check all day long with the information that I am giving to you guys. I mean, this is just me sharing the things that I know. And this is me just breaking it down for you. But please look and see what other references you can come up with, or what other clarification can you get, okay? But in the instance of, you know, these modifiers, it really does help to have somebody sort of explain it, right? Because when you think of all these things like, oh my gosh, I just learned how to do procedure coding, I just learned how to do diagnosis coding, and now I've got to learn this modifier stuff. Yes, it is very important, especially, like I said, with that modifier 57. That's decision for surgery. That is, you know, looking at this procedure and thinking, oh, okay, this procedure has 90 days on it, and I'm going to append this modifier 57 to this evaluation and management level so that everybody knows that that provider made the decision to perform that surgery the day of or the day before, okay? So very interesting stuff. What else can we learn today about this? Let's talk about what services are included in the global surgery payment, okay? And this is from the CMS.gov website and from the Medicare Learning Network. And I'm just going to read some of this to you guys. Take with it what you wish, okay? Just sharing information from the website. Medicare includes the following services in the global surgery payment when provided in addition to the surgery. Preoperative visits after the decision is made to operate. For major procedures, this includes preoperative visits the day before the day of surgery. For minor procedures, this includes preoperative visits the day of surgery. We're going to talk about different global days on another episode, okay? So just sort of go with it. Go with it here with me. Intraoperative services, that are normally a usual and necessary part of a surgical procedure are also included in the global surgery payment. All additional medical and surgical services required of the surgeon during the postoperative period of the surgery because of complications which do not require additional trips to the operating room are also included. Follow-up visits during the postoperative period of the surgery are related to the recovery of the surgery. So this means that when a patient is in this global period, right? They've had their surgery and they have a 90-day global period. This means all the visits that are related to that surgery are going to be included already in the surgical payment, okay? And so this means that you would append that 990, you would apply 99024, which is that signaling that this is a part of the global package, and you would do that the entire time that they come in for visits about that during the global period, okay? Whatever they had their surgery for. So this is like really important stuff to know. And then I will be talking about modifier 24, which is another modifier that you can append, but it is when there is an evaluation and management service that is performed during the global period that has nothing to do with the whatever they had a surgery for, but it is a separate issue completely, okay? And we'll be talking about that on another episode. But just for illustration purposes, we're just talking about what is included in that global surgery payment. Post-surgical pain management by the surgeon. Sometimes a patient will come in and maybe it's a couple of weeks after they've had their cast on, okay? And they say, well, I'm really in a lot of pain and I can't, it just really hurts. And so the provider does a little bit more to manage their pain, either gives them a shot or, maybe changes their pain medication. And if that's the case, that's included in the global surgery payment. They would not get a separate evaluation and management for that because it is a part of taking care of that condition. There's going to be some allowances to those things, and they understand that. That's why they're making it clear here, okay? Supplies except those that are identified as exclusions. Miscellaneous services such as dressing changes, local incision care, removal of operative pack, removal of cutaneous sutures and staples, lines, wires, tubes, drains, casts, and splints, insertion, irrigation, and removal of urinary catheters, routine peripheral intravenous lines, nasogastric and rectal tubes, and changes and removal of tracheostomy tubes. So all of this is included in the global surgery global surgery payment. I will get it together today. But yes, all of this is included. So a lot of times they say, well, I'm just changing a cast, I'm not going to get paid. Come on, you've already been paid. That it's part of the package. All of that is included. And sometimes when I hear that, really, Blue, but they came in and I had to adjust their medication, it's still considered a part of it. So knowing what is included in these things is really important, because when your providers come looking for you and asking you these questions, to explain to them why you were able to do it, and it's very important that you have resources like this. And if they say, well, this is Medicare, well, most insurance carriers will follow. These are the rules, okay? And it's pretty much standard across the board on these rules. Some insurances, may do a little tweaking here and there, but for the most part, everybody follows these same rules, okay? So just because it says that, it doesn't mean that it doesn't apply to everybody. It generally does, okay? So that is the difference in knowing, right? Knowing your resources and understanding. This is why they always say that even if you are not doing the billing, it's important to understand the billing. It's just like, I really do wish billers would be certified in medical coding. Not just the billing, but I do wish they would be certified in medical coding, because then they would really understand the rules. But generally, billers are just processing paperwork, so their technical knowledge does not have to be the same as us medical coders. And a lot of times people will ask me, well, really, why do I have to learn this stuff? I'm learning it in school. It doesn't mean that you necessarily have to be a biller, okay? I've been in this industry for over 10 years, and I have never done billing, but I do understand the billing side. I mean, could I pick it up? Certainly, because I feel like I can do anything, but when it comes to understanding the rules, it's important. And if you are out looking for a job now, and you're still applying everywhere, even though they're telling you that we need 1 to 3 years experience, 1 to 5 years experience, you're still applying anyway because you watched my video. So take the time, read the CMS website, read any insurance carrier, whatever insurance carrier you want to read, okay? Just check out what their website has to say. Check out their rules, and it never hurts to understand these things, okay? So this way you can get a working understanding, all right? And we'll probably be going over some more of these examples. Like I said, next one's probably going to be Modifier 24. So that way you guys can start to get into it a little bit more, and just really start to see how these are applied, and hopefully with these examples it'll help you to understand a lot better. Okay, so that's my episode for today. I know it's a little short, but it's short and sweet, you know what I'm saying? So anyway, I have a great lineup planned for next week, and I'm very, very excited. So I hope you'll join me next week on my show, 7:30 p.m. Central Standard Time, and I will see y'all then. So I hope y'all have a great weekend. If you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.